Next slide, please. Okay, this seminar is being recorded, and so that means it will be available for folks after the fact. All participants are muted. Please use the chat function to submit questions for the question and answer session at the end of the presentation. We'll be saving those, and I will be asking the speakers questions that you submit via chat. So as a reminder, Spanish interpretation is available that you can select below. And then we also are utilizing closed captioning. If you'd like to utilize that service, please select the CC icon below and click Show Subtitles. Next. So I am thrilled to introduce our three speakers, one from UC San Francisco and two students from UC Davis. They're going to be talking about COVID-19 education and resource development for Punjabi-speaking agricultural workers in California. And so we have Anu Singh, Neha Singh, and Harsimran Kaur. I am sorry. Thank you for joining us, and I'm going to turn this over to you, Anu.
Awesome. Thank you everyone for joining. And Harsimran, if you could share the slides, that would be wonderful. We have the present view. Perfect. Hi everyone. My name is Anuvir, or Anu, like a new person, if that helps you remember my name better, or how to say it correctly. I will be going over a project that I worked with Harsimran and Neha over the last year regarding COVID-19 education and resource development for Punjabi-speaking farm workers in California. Next slide, please. So a little bit about me. So I was born and raised in India. I moved to Central California to a small town called Carruthers when I was in high school. And then now currently I am a medical student, fourth year medical student at UCSF School of Medicine. I'm currently in their Prime US program. Prime stands for Program in Medical Education, and the US stands for Urban Underserved. It's a 5-year kind of track where you obtain additional degree or do some sort of scholarly work along with your MD. I did my master's in public health at UC Berkeley as part of that additional degree requirement last year. And currently I'm applying into emergency medicine residency. I just applied last week and awaiting interview invites now. My clinical and research interests include social emergency medicine, which is this field where they kind of, it's new and upcoming field where they try to incorporate social determinants of health into emergency care. So oftentimes we think that emergency room providers kind of limit themselves to the hospital setting, but with this field, there's a potential to reach out and prevent disease and prevent folks from coming into the hospital and then kind of address their needs out in the community. Other research interests include rural and farm worker health and mentoring first-gen students, and lastly, public health and public policy. So the project that we'll be going over was part of my capstone project, which I did as part of my master's degree at UC Berkeley. And then I'll have Neha introduce herself next.
Hello, everyone. My name is Neha, and I recently graduated from UC Davis in neurobiology, physiology, and behavior. I worked as a student researcher in the Center for Health and Environment department, and I also worked with Dr. Pinkerton and in his lab. Some of my clinical and research interests are medicine, health, and environment, and as well as public health. And that was like one of the major reasons that I wanted to become a part of this project. I'm going to pass it off to Harsimran next.
Okay, I was muted, my bad. Hi, everybody. My name is Harsimran, and I am a fourth year UC Davis undergraduate student. I am majoring in global disease biology. Just like Neha, I'm also working with Dr. Pinkerton as well, and some clinical and research topics that interest me are medicine, psychiatric disorders, pediatrics, and public health. And I'm gonna pass it on to Anuvir.
Awesome. Thank you for those introductions, Neha and Harsimran. So in this presentation, I will be going over the work that I did as a master's capstone project at UC Berkeley. Here's sort of the agenda for today's presentation. I will go over the background, or we will go over the background, public health significance, research objectives, research methods, results, conclusion, and we'll end with questions. So I just wanted to share my topic inspiration for this project, which stems or comes from my father, who is a farm worker in Fresno County. He's pictured here along with me. He's the one in blue, along with his coworker. So I wanted to take this moment to acknowledge also the support and guidance that I received from the Agriculture Center at UC Davis. Dr. Pinkerton, both Harsimran and Neha, they have mentioned him before, but he was also my mentor. And then Heather they have been instrumental in helping me develop and conduct the study. So with that, let's move on to the background for our project, which will be presented by Neha.
According to the 2013 and 2014 National Agriculture Worker Survey data, 73% of agriculture workers in the US are foreign born. And of these, 68% were born in Mexico, and then 4% were born in Central American countries, and then 1% in other countries. So these include farm workers born in Asian countries like India. So the Western Center for Agricultural Health and Safety have extensive knowledge and experience in developing the COVID-19 educational resources from farm workers. And these resources are currently in English and Spanish only. So there are no COVID-19 educational and safety resources that serve the Punjabi-speaking farm workers. This project was aimed to fill this gap and extend the work for the Agriculture Center at UC Davis to make these resources available to the Punjabi-speaking farm workers in California. This project also has a huge public health significance. Through this project, we were able to address health inequities through the creation of culturally competent and farm industry specific COVID-19 educational resources for an underserved Punjabi farm worker speaking community. These resources also helped improve the understanding and safety practices to prevent the COVID-19 transmission among this community and this entire population as a whole. Our goal is to provide culturally competent, linguistically appropriate, and agricultural industry-specific COVID-19 resources to the Punjabi-speaking farm workers in California. And Harsimran is going to be sharing the research objectives next.
All right, so here are a list of our research objectives. To begin with, we are conducting this study to basically understand the COVID-19 educational needs of Punjabi-speaking farm workers in California. We will assess the content, visuals, and cultural relevance of current COVID-19 educational resources that have been developed by the Agricultural Center at UC Davis. Using this information, we will develop new COVID-19 educational resources for Punjabi-speaking farm workers. Lastly, we will disseminate new resources in collaboration with community organizations such as Jakarta Movement, the Western Center for Agricultural Health and Safety, and other agricultural industry representatives. Yeah. And I think this is going to be Anuvir who's going to share the research methods.
Yeah, so this is a qualitative study that we conducted in 2 phases. So in phase 1, we conducted 4 to 5 key informant interviews. Not 4 to 5, we actually ended up conducting 5. Initially, we thought it'd be either 4 or 5. So we ended up conducting 5 key informant interviews using a semi-structured interview guide, which I'll be sharing in subsequent slides. So we basically asked participants open-ended questions to assess current COVID-19 educational resources, like whether they met their needs or not. And then based on that feedback, we developed new resources. And then in phase 2 of the study, we conducted 3 focus group sessions with 5 participants in each group. 2 were conducted in Fresno County and 1 was conducted in Yuba County. So a discussion guide similar to the one that we used for key informants was used to test the newly developed COVID-19 educational resources and whether the participants actually approved those new resources or whether they wanted to give any other advice or input. Following which any necessary changes were made, and we plan on disseminating these resources after all the approval from the participants. Next slide, please. So click one more. There we go. So here's the first half of the interview guide that we created. So I know it's pretty wordy. I couldn't put it into, I just wanted to share the guide that we created. So it started with the overview of the study after obtaining the verbal consent. And then we asked them questions that were categorized into 4 major themes. The first one being the key themes for farm workers. The next one was key themes regarding platforms. Third one was key themes regarding print materials. And lastly, key themes regarding radio and video examples. Click next slide, please. One more. Yeah, these are the other 3 themes that I mentioned right now. So we won't go over each of these categories in detail, but I just wanted to use one as an example. So for instance, key themes regarding print materials had questions that asked the participants for their preferred size for the print materials, whether they liked a standard handout size, a pocket card, or a booklet, or whatever their preferences were. And then questions based on image preference, photographs versus illustrations, amount of text they wanted on the handouts, and the colors of educational materials, among many other things. So this slide that we have currently in front of us, these were the resources that have been published so far by different organizations, including the Ag Center at Davis. So these were the resources that were used to kind of elicit input from participants during key informant interviews. You can see how these resources are pretty specific for the agricultural industry. They show illustrations of folks working in the farms, among other things. Next slide, please. So these are the other resources that we use, which are also kind of specific to the agricultural industry. For instance, carpooling. A lot of the farm workers carpool to and from their workplaces. And then the second one was, I know it's in Spanish, but we were mainly assessing, the amount of content, the visuals and the colors for these resources, not the content of the resources, since most of our participants did not read or speak English. Next slide. And lastly, these were the 2 resources that we also showed our participants. The first one is a resource on commonly touched substances or materials at work, and then how to sanitize your hands after touching your phone, to using a bathroom, after ID checks, among other things. And then the last resource that we used was this pocket card. It was actually a flip card where you can fold it into half and put it in your wallet. We wanted to assess whether participants would appreciate something of this nature or not. Next slide. All right, so like I said, we conducted 5 informant interviews. So based on the findings, participants mainly wanted to obtain COVID-19 knowledge from TV, physicians, or family members. Interestingly, no participant received any COVID-19 resources in Punjabi from their employers. So there was a unanimous interest in receiving COVID-19 education and safety information. They all wanted to, be safe and practice appropriate measures. And then of these safety resources, they preferred handouts, posters, and videos over workbooks or photo novels. And then similarly, key themes regarding platforms. So there was a heavy reliance upon printed materials. None of the farm workers used any social media or online platforms to obtain safety information regarding COVID-19. So in terms of preferences for print materials, so they all wanted, they had a preference for printed materials, but within that category, they preferred a standard paper size materials, which was 8.5 by 11-inch paper size. And they had a unanimous support for culturally relevant photographs, including pictures of individuals with turbans wearing a mask. Further, there was a heavy preference for limited text. Most of them agreed with 50% text and 50% images. And lastly, colorful resources were preferred over black and white resources. Here's an example of what one study participant mentioned during their key informant interviews. They said that if the pictures can show someone of Punjabi background wearing a turban, that would be good. I do not like cartoons in printed materials, which was agreed, as you'll see later on in focus group discussions. This was like a heavy preference for participants asking for resources that represented their community and that showed people that looked like them. Next slide. So lastly, so on key themes regarding radio and video examples, radio and safety messages were unanimously found useful. There was a preference for videos as well, as long as the videos were currently not on the correct slide. If you could go back one slide, Harsimran. There, yeah, that one. So in terms of video preferences, participants preferred live action video illustrations. One of them mentioned, I do not like cartoon illustrations. The standard length that they wanted was 1 to 3 minutes, not too long, not too short. And then the characters, which I already mentioned earlier, they had a heavy preference for characters that represented the Punjabi community. So videos of Punjabi people practicing safety, I would find them more relatable and helpful. That was what one of the study participants said. Actually, there are 2 radio stations currently that are used by Punjabi speakers within California. One of them is aired on the weekends only, 900 AM. And then the other one is 1300 AM, also known as the Punjabi Radio USA, which is 24/7. So most participants mentioned that they do listen to radio messages while driving to and from work. And one even said that he has his radio on all the time and kind of listens to everything that the folks on radio have to share. All right, next slide. So these were the so after initial feedback and initial interviews of key informants, we developed basic resources based on what their preferences were. So the first resource on the left shares information on how to stay safe from contracting COVID-19 while working in the farms. The second resource on the right shares basic information on COVID-19. Both of these resources are, they use actual pictures. As you can see, these were the pictures that were taken by us, and we asked the participants if we could use them. They gave their approval. And both of these resources were taken near, our pictures were taken near our farm in Fresno. The first resource kind of like focuses on general safety measures while at work. The second one is just like overall general information regarding COVID. All right. I am going to slow down a little bit for, I see that we have an interpreter on file too, so I might be speaking a little too quick for them. So I will slow down. And if there are any questions at this moment, we will take them, or you can put them in the chat and we'll address them at the end. These are the pictures of other resources that we developed. Again, the one on the left, which I shared earlier, was in English, which was developed by California Strawberry Commission. Kind of goes over basically all the mainly constantly touched devices or equipment at work, and then how, like, what to do after you touch these. You sanitize your hands or wash your hands with soap and water. The picture on the right, I created this resource. It's just like because a lot of the participants had preference for pictures over words. So I just wanted to emphasize that. So the one on the right shares information on kind of like, at work, you should keep your hands clean. And then the second or the third picture in there says, maintain social distancing while eating or while at work. And then lastly, it says wearing masks while at work or some sort of facial covering. Mask is another issue that came up several times, which we will address later on too. But sort of like demonstrating community members in these resources, and then using their preferences to create resources and involving them in this work was what we were trying to do. Next slide. And here's a video, a sample video of what we here's a sample video of what we created in collaboration with the Ag Center. It's on vaccine safety. There was a lot of hesitancy regarding vaccines within all communities, but also within the Punjabi-speaking community. So this was a video we created in collaboration with them. And then I used that video as an example, whether if this was some of the information that they would have received, that they would have liked to receive. And then it was a short video. And then of course it was a person, their preference was to have this information relayed to them by someone who speaks their language and who looks like them. So we created this resource and then kind of used that resource to test for the preferences. Again, this wasn't for the content, this was just to elicit their preferences. You can play for like 20-ish seconds, Harsimran, and then we can go to the next slide.
ਵੈਕਸੀਨ ਦੇ ਟੀਕੇ ਮੁਫਤ ਵਿੱਚ ਲਗਾਏ ਜਾ ਰਹੇ ਹਨ, ਪਰ ਇਹ ਪਹਿਲਾਂ ਕਲੀਨਿਕਾਂ ਤੇ ਹਸਪਤਾਲਾਂ ਦੇ ਕਰਮਚਾਰੀਆਂ ਨੂੰ ਲਗਾਏ ਜਾਣਗੇ ਅਤੇ ਫਿਰ ਬਜ਼ੁਰਗਾਂ ਨੂੰ। ਇਸ ਟੀਕੇ ਨੂੰ ਲਗਾਉਣ ਲਈ ਤੁਹਾਨੂੰ ਇਮੀਗ੍ਰੇਸ਼ਨ ਦਸਤਾਵੇਜ਼ਾਂ ਦੀ ਜ਼ਰੂਰਤ ਨਹੀਂ ਹੈ ਅਤੇ ਕਈ ਕਾਉਂਟੀਆਂ ਨੇ COVID-19 ਵੈਕਸੀਨ ਦੇ ਟੀਕੇ ਖੇਤ ਮਜ਼ਦੂਰਾਂ ਨੂੰ ਲਗਾਉਣੇ ਸ਼ੁਰੂ ਕਰ ਦਿੱਤੇ।
Awesome. So it was just talking about, COVID-19 vaccines. Again, that wasn't the purpose of her project, but again, the purpose of her project was to elicit preferences regarding different resources, because that work has not been done. Before we even publish resources, we wanted to elicit what the actual preferences of the community members are, and whether if those resources are published, whether they would be accepted by the members and used by the members.
COVID-19 vaccine.
And then here's a radio message again that I used CDC's, one of the messages created by CDC early on, and early on during the pandemic, which was titled "Coronavirus Stops With Me." So I translated that message into a Punjabi radio message, which was this message was initially delivered by ex-Surgeon General Jerome Adams. So I kind of translated it into Punjabi to elicit whether if that short message was something that they would have found helpful if they were given the chance to listen to those messages during the early phases of the pandemic. Right, you can play that for a little bit, Harsimran.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ, ਮੇਰਾ ਨਾਮ ਅਨੁਵੀਰ ਸਿੰਘ ਹੈ ਤੇ ਮੈਂ UCSF ਵਿੱਚ ਇੱਕ ਮੈਡੀਕਲ ਵਿਦਿਆਰਥੀ ਹਾਂ। ਜਿਹੜਾ ਮੈਸੇਜ ਹੁਣ ਤੁਸੀਂ ਸੁਣਨ ਜਾ ਰਹੇ ਹੋ ਇਹ ਅਮਰੀਕਾ ਦੇ ਸਾਬਕਾ ਸਰਜਨ ਜਨਰਲ ਜਰੋਮ ਐਡਮਜ਼ ਵੱਲੋਂ ਹੈ। ਪੂਰੇ ਦੇਸ਼ ਵਿੱਚ ਕਰੋਨਾ ਵਾਇਰਸ ਦੇ ਪ੍ਰਸਾਰ ਨੂੰ ਹੌਲੀ ਕਰਨ ਲਈ ਅਸੀਂ ਕਈ ਕਦਮ ਇਕੱਠੇ ਚੁੱਕੇ ਹਨ। ਹੁਣ ਸਾਨੂੰ ਆਪਣੀ ਅਤੇ ਆਪਣੇ ਪਿਆਰਿਆਂ ਦੀ ਰੱਖਿਆ ਲਈ ਨਿੱਜੀ ਜ਼ਿੰਮੇਵਾਰੀ ਨਿਭਾਉਣੀ।
Awesome. So again, this message, the radio message, I tried to kind of like emulate some of the radio hosts and try to speak slightly quicker to get the message across. And it was actually well received, as you will see in the subsequent slides. All right, so after this slide, I'm going to hand it over to Harsimran and Neha. But for this slide, so again, we did the key informant interviews, and then we created resources, and then we tested those resources using focus group discussions. So this is the feedback that we received on our newly developed resources. So again, all of those, there was an overwhelmingly positive support for newly developed resources across all three focus group sessions. Specifically for the printed handouts, all of the participants agreed that the colorful printed materials in Punjabi met their needs. And then one even said that the text was big enough that they could read without their glasses, which was really important for them because they don't always wear their glasses. So that wasn't what we were intending to, achieve, but it was reaching a wider audience. So it made us happy when we heard that. Again, there was unanimous agreement on having bigger font for resources and using actual pictures of community members, which we did, and then they all approved. There was one recommendation that one focus group had was to include summary statements or key points at the end of every handout, just like one big summary statement, which was bigger in font than the other text, just so that they know what the take-home message was.
Okay, I think this is my slide. So the newly developed COVID-19 educational resources found unanimous support among study participants. The video messages were well received and found to be informational. And on top of that, there were no additional recommendations for the videos.
Okay, similarly, the radio messages were also well received, and participants agreed that they would find such messages helpful if they were actually shared on the radio. And I will also be sharing some of the quotes from our participants. So the first one is, if this information was shared before, this coronavirus wouldn't even spread. We really didn't know before. Another participant said that we would like to hear such messages on the radio. I keep my radio on all the time in the car and at home. And then last one is that these messages make you become more aware of your surroundings and take necessary precautions early.
Awesome. Like I mentioned earlier, that there was a finding regarding masks, which we were not intending to elicit, but it came up multiple times. So a lot of the participants shared their frustration with putting the mask on with the turban. As you can see in this picture, some of the individuals who wear turbans don't have their ears exposed. So it's really hard to kind of put the mask on, especially the masks that are the elastic kind that don't tie on your head. It's hard to put them on with the turban. And then majority of the participants suggested that the government or retail stores and employers or other stakeholders actually share masks with them that they can tie over their turbans, which would make them more compliant in wearing that mask, because the mask that they were given, they just couldn't put them on without having difficulty putting it on. So again, this was a key finding, but it wasn't like an intended finding, but this came up several times during key informant interviews and focus group discussions. They were saying, yeah, like sometimes the employer shares the mask with us, but we can't put it on. So we just, don't use it. And then we can see how that can be harmful for this community in terms of contracting and transmitting COVID-19. So those were basically the main findings. And then so the conclusion here is that the current COVID-19 educational resources are not meeting the needs of Punjabi-speaking agricultural workers. I am sure these findings can be extended to other communities beyond the Punjabi-speaking community, but I will speak from this community's perspective only and share that some of the resources that are published in English are not culturally relevant or linguistically appropriate. And they're not specific for the agricultural community, which is what these community members need. And then also there is a need for educational and safety materials that are, like I said, culturally relevant, linguistically appropriate, and in different formats. There's preferences for handouts. There's a heavy reliance on handouts, but some folks don't have the capacity to read, even in Punjabi. So maybe using multiple forms of media, including videos, like messages on television, or radio messages, which were, surprisingly had a high usage of participants use radio in the farm working community. So those would have been really helpful. yeah, so these are just the basic conclusions from our study. And then next I'll go over basically the timeline of our project. Yeah, so this, like I said, was my capstone project. So in December 2020, we received IRB approval at UC Berkeley. So literature review was conducted in January of this year. And then most of February and March was spent in figuring out the logistical issues of having both Harsimran and Neha on board, because they were not affiliated with UC Berkeley. They were UC Davis students. And it was just like you had to play a lot of IRB gymnastics for this, actually. So they underwent their own IRB approval process at UC Davis. So upon their approval, they could help me with focus group facilitation, transcription of the interviews, and analysis of the data. So we used the thematic analysis, which Harsimran and Neha helped me abundantly with. And then we used the theoretical frameworks of grounded theory and ethnography to kind of elicit theories regarding what the preferences of folks were regarding COVID-19 resources. And then so in April, we finished the key informant interviews and developed new educational resources based on participant feedback. And then we also presented our findings at UC Merced Farm Worker Health Conference in April, which I received a great I guess like feedback from the participants there. And then we used that feedback to kind of incorporate into our future work. In May, we conducted the focus group discussions, and we are currently in the dissemination phase of our study. So like I mentioned, we have already presented at the Farm Worker Health Conference at UC Merced, and then we will continue to share this work further. I have some exciting news that I was sharing with folks who joined early on, that I am one of so Senator Alex Padilla, he's a senator of California. He is having, UCSF has invited him, for just like a Q&A session on Wednesday. And students were offered to ask him questions, and we had to like share our questions with the governance team at UCSF, and they happened to choose my question. So I will have the opportunity to ask Senator Padilla a question, and which revolves around my work here. And it's a live Q&A session. So I'll be directly talking to him, and then kind of using this process and then holding folks who are in power accountable for, not only creating policies. So my question is based on like that I have observed that many legislatively mandated health and safety measures, such as providing PPE to farm worker community, is well-intentioned in policy, but it's not always implemented in practice. So basically my question is going to revolve around how can we ensure that legislatively mandated policies, which have a desired impact on protecting the community they're intended to help, but they are not actually reaching those community members at that individual level. So how can we kind of reinvest in workplace safety and ensure protections for those who are supplying our nation's food and other essential services, especially during the pandemic? So if you guys want to hear Senator Padilla's answer, they'll be recording this session too, but I believe I can share the link with the team here if you all want to join. Happy to do that too. But basically the question drives from my work from last year and working on this project, which I first-handedly noticed that a lot of the policies were being passed but not being implemented, and then folks were not held accountable for not implementing those policies. So there was a lot of pat on the back in terms of like governor and just like legislative folks like saying, hey, we're doing this for these communities, but at that individual level, like speaking from my father's perspective, from the farm worker perspective, they were not reaching them actually. For instance, like, masks, like, yeah, some employers were providing the masks, but they were not doing the work that they were intended to do. So I think it's kind of neat that I have this opportunity and this privilege to ask someone in power this question on behalf of the farm working community. And then beyond that, I hope to publish these findings sometime. Currently in the residency application phase, but when I have some time, I plan to publish them. So future work regarding creation of resources can be guided by what we found. Next slide. Again, thank you everyone for participating. So acknowledgements, of course. Just wanted to acknowledge the abundant support that I received from the Western Center for Agricultural Health and Safety at UC Davis, including Dr. Ken Pinkerton and Heather Ryden. Also UC Berkeley School of Public Health. So this was my capstone project through UC Berkeley. So my advisor, Dr. Karen Sokol-Gutierrez, who has been instrumental in guiding me, through this work and helping me through the IRB struggles. And lastly, the Punjabi-speaking agricultural workers, especially my father. His name is Iqbal Singh. His work and his drive basically kind of drove this project further. And then what I saw when he would come home, and then all those struggles and the anger that I had for the big employers and for not providing this work. I couldn't face them directly, so I wanted to channel that energy in a meaningful way and help that community. So yeah, thank you to all the folks who were present here today. I'm happy to take more questions.
Wow, that was phenomenal. Thank you, all three of you, for presenting that information. I wish that it was no longer still so relevant to what we're doing every day. I wish that COVID was in the past and we could be thinking about immediately applying these findings to other health and safety topics. But I think there's so much potential for us to collaborate to apply your findings to COVID now, because it's not over, as well as numerous other topics in the future. We have a lot of questions and a lot of opportunity for discussion. So I will start with some, and then I'm just gonna kind of keep directing them as we go. One question that really came up to me, and since I'm moderating, I get to ask it first, had to do with the degree to which it looks like you were in some work sites. I'm curious whether employers were aware of your activities and whether or not they seem receptive to, are they a dissemination avenue, or do you feel like moving towards some of these other community-based and family-based outreach mechanisms are going to be more successful? But what did you experience from the employer side?
Yeah, so one of the focus groups that we conducted, two of the focus groups we conducted were actually in the farms during the lunch breaks of farm workers. So we don't want to, take extra time out of their day because they're already tired. And then we wanted to use that time they could eat and kind of, chit chat while eating, and then not think that they're wasting time. Also, it was nice that we could get funding for this project through the Ag Center, and then we were able to compensate participants for their feedback. So that was really helpful. But one of the other sessions that we had was at a local park in Fresno. So there were no employers involved, and we wanted to have both of those settings to see whether, participants change their preferences based on whether they think that the employer might find out or might look at or might hear. But I think I spoke with the employers. They were small farmers. They were not like big agricultural companies. So these were small farmers. Two of them were from the same community, so they understood the basic needs that their workers were facing, and they were actually very receptive for the feedback, and they really thanked us for showing up. I remember the one in Yuba City, they even offered us snacks, and they organized this whole thing that we were coming to talk to their employees. So it was really nice to see that they were being receptive to the feedback, and that we were there not to criticize them, but just to elicit opinions and feedback from the farm workers and what just kind of eliciting their preferences. It wasn't like a critique on their farm. And then of course, like we told them that everything is confidential. We're not going to share which farm and which participants. So all those issues. So that helped us gain some trust. And then like my father is a farm worker. So one of the employers we went to was like my father's. So he already has a decent relationship with that employee or that employer. So he kind of like helped us navigate some of the issues, and he gave me tips on things to say or not say in front of his employer. So that was really helpful. Yeah, I think like most of the time like they were very receptive and agree. They were thankful that we were actually there, eliciting also their community members' preferences.
Great, thank you. Another sort of study methodology question. Could you describe your recruitment process for both the interviews and the focus group?
Yeah, so for interviews, I started with my dad at home. It was just like, and then kind of used the snowball sampling early on because it was really hard to recruit participants in an era when the COVID was, we were having multiple peaks all the time. Every month it was like, another peak. And IRB, of course, was giving me a lot of trouble to recruit participants. This is way back when we were in different tiers. So Fresno County for the whole time was like in purple tier, which is like, you don't talk to anyone outside of your house. So it was really hard to recruit participants early on. So I started with, my father and then the person that he goes to work with, eliciting their input because, they share a ride. And then we kind of did a backyard, kind of like in a safe way, practice social distancing and then masks and stuff. We did an interview with them. And then also I left a few flyers at local community centers at the gurdwaras, which is a place of worship, and then grocery stores. So that's kind of like how, and then we gave participants a chance to reach out to us first, so they don't feel forced that we're reaching out to them. So it was sort of like random sampling, but also like initially snowball sampling, given that we were living in a pandemic. And then for focus group discussions, again, I use my father, workplace as one focus group. And then we reached out to community members who, like the Jakara movement and other organizations who kind of helped us find another focus group. And then once I had enough participants, we organized that focus group in a local park in Fresno. And then lastly, Harsimran and her father helped us find another employer who was interested in working with us and asked their employees whether they would be willing to give input to us. So that was conducted in Yuba County. I see a question like what sort of like farms that we went to. The one that I went to in Fresno was a grape farm. So most of the Punjabi-speaking farm workers within Fresno County work in like grapes and almonds kind of area. And then the ones in Yuba City, I believe, we went to a peach or nectarine farm. So yeah, that's those were the two farms that we went to. And then the third one, like I said, was at a local park.
Great, thank you so much. Switching to more current topics that are of concern for all of us, meaning vaccines. So I mean, that is the topic of COVID, right? And what is among the communities that you've worked with, the perception of vaccines? Are there vaccine concerns and hesitancy? Are people getting vaccinated? What's the word about vaccines among Punjabi-speaking farm workers?
This isn't like, I'm not generalizing to the whole community here, so I'm going to speak from my perspective and use I statements, so I don't make any generalized statements about a diverse community. So from my personal perspective, I feel like older folks are more likely to get vaccinated, especially the ones who have their kids vaccinated, and they kind of just listen to folks at home like, hey, I told my mom like, hey, you need to get vaccination, like it's going to help everyone, you and the community. And then she's like, okay, sign me up. And then she was like bugging me until she got vaccinated. And then recently, yesterday, she's like, I got my flu shot, you haven't, go get it now. And then so I was like, okay, like it has definitely caught on, even though my parents are both not in science. My dad's a farm worker, my mom like worked at foster farms, so they're not into like any science world, but but they understand the impact that vaccines can have on improving lives. And then, so all the older folks, at least like within like the ones that I know, are more likely to receive vaccinations. It's the younger folks that I think within my community that have, like, my cousins are hesitant to receive vaccine because either it sometimes it's said too much information is bad for you. I don't know what they read, but they read something crazy on internet and then they always question me. But then again, if they need any medical advice, they'll come running to me. So I'm like, okay, you can't have it both ways, you know, like either you trust like medical providers or you don't. You can't just pick and choose. Like they'll trust the treatments for COVID, but not vaccines. And I'm like, actually vaccines are studied, you know, for a longer time than the treatments, you know. So it's funny because younger generation is more hesitant within my community from like what I've seen than the older folks, older as in like, you know, over 60, 70.
How about Neha or Sim? Do you have any experiences on that vaccine uptake or hesitancy?
Yeah, well, where I'm from Yuba City, so there's a lot of anti-vaxxers and anti-mask individuals living there. So even my best friend was hesitant towards getting the vaccine just because she lives in a household where they're anti-vax, but thankfully I was able to provide her resources and now she's vaccinated, but still her family isn't. And I think the thing with people when they're hesitant towards it, when they do research, I feel like research for COVID-19 is more of like they're just going to look for articles that are on their side that say like the vaccine is not effective, it's not essential, and they call that the research, and it's more of like a confirmation bias to me. But the best way is just to spread the message. And for the Punjabi community itself, I know there's a lot of language barriers out there. And so we did talk about a nonprofit organization in our PowerPoint presentation. We talked about Jakarta Movement, and Jakarta Movement does have their own organization called Jakarta COVID Team, and they've been doing a great job with, you know, hosting clinics at gurdwaras, which are the Sikh temples that we have here locally. And I think it's just on outreach. And so with language barriers, there's always a solution to a problem. So I'm thankful for the Jakarta COVID team that continually every week hosts like clinics at various gurdwaras around California. And that's basically where I would point towards, like if I had a Punjabi member who wasn't sure about the vaccine, didn't know how to do it, don't know what paperwork's to fill out, like that's a good resource to go to. So I don't know if Neha wants to add on to anything.
Oh, I agree with Anu and Harsimran. I do also have experienced the older generation getting more vaccinated, and then the younger being a bit more hesitant towards it. And in terms of like the medical providers, usually every medical provider that I talk to who are also Punjabi, they're mostly vaccinated, and then they do support, you know, research, as well as like they're more scientific based as well. And then the other reasoning was like Harsimran shared, like it's more of like just a confirmation bias, like if you're not doing your extensive research on it, and then they're just not informed. So I think definitely outreaching helps. And yeah, that's what I have to say.
Thank you. And I think your research findings show the importance of the culturally tailored resources and information for people to be able to absorb the information and believe it because it's prepared for them. A sort of tangential question that I'm wondering if any other health and safety topics came up through the course of your interviews or your focus groups related to the occupational, the ag workplace. Were there any other discussions about hazards or other workplace issues that you heard about?
I can briefly share. I think most of the time it was regarding like, you know, since we were interviewing people between like, you know, December to ish, like April-ish, like COVID was highly prevalent I mean, it still is, but at that time, like, you know, even there were even like limited resources for the community. So most of the conversations tailored around that. And then our discussion guides were also focused on COVID-19. So there was not much room, like wiggle room to like, you know, go around. And, but there were other topics that came up, particularly, I feel like heat and wildfires came up a couple times. And especially when we were talking about masks and how like it would help to wear a mask when the air quality is so bad, but at the same time that they feel exhausted because they're working in like, you know, soaring temperatures, especially in Fresno County. Farm workers, you know, mostly work over 100 degrees, like for most, like, you know, during the harvest months. So they did mention that some of the resources regarding heat and wildfires would be helpful to, like, you know, and then have some sort of like safety measures taken by the employers, especially on days where it's like really unbreathable to go outside and have a bit of like a breathing room for them in their schedule to leave early or like take a day off without like getting penalized. So that's something that came up. I would say like those were like the main ones, like heat and wildfires, but they came up after we were discussing like topics on masks.
Well, I think that mask point related to wildfires is really important because one of the primary or one of the core elements of the wildfire smoke exposure regulation with Cal OSHA is the provision of N95s to workers during smoky days. And the you know, I mean, they do go over the back of the head. So I anticipate they might be able to fit over someone's turban, but there's other fit issues with facial hair and things like that. And I think that special instructions and guidance is probably warranted to make those as effective as possible for farm workers. Sort of a follow-up to this more general training and sharing of information. Did you find that people were more receptive or wanted to be given safety information more from a man or a woman? Does it matter? Are there other sort of preferences of that sort that you learned about?
So all the participants in our study were male identifying, and that's pretty common within the Punjabi community. I personally do not know a woman farm worker within my family or extended family or in the community. So, and there are a lot of women in like assembly line jobs. Like for instance, like my mom works at foster farms and men mostly work outside, like in the farms. So there was no preference in that regards, I feel like, but they really appreciated us like sharing that information, and they kept saying like, hey, like no one comes here and talks to us and gives us money, which, you know, we were compensating them. They're like, wow, you're gonna like just chat with us during lunchtime and offer us some money and get our input and, you know, use our findings to create resources. So they were kind of like awestruck by what we were doing. And yeah, they're like, just like regardless of where it comes from, like I said, you know, different people had different preferences. Like some people receive information from TV, some said physicians, some said family members. So I think any avenue would be helpful, at least like not, it might not work for everyone, but like different sorts of like forms of media can work together to create kind of like a broader audience. Yeah, so I don't think they had a preference. I don't know if Neha and Harsimran have anything else to share, but personally for me, they did.
I thought that the message was also well received. It didn't matter if it was a woman talking or me or Harsimran or if it was Anu talking. They were very like appreciative that we did reach out to that community, and then we were working on something that would eventually help, you know, in their safety and their health. And I think that's like the main like message that I got from that. I didn't think that, you know, they would be hesitant if the message was coming from me or Harsimran or Anu. I think that working in teams was also actually really helpful. You get like a stronger input from a group of people instead of just like one person as well. So I thought that was really great. how we were able to kind of teamwork and balance as well when we did got interviews from our participants.
I don't really have anything to add. I agree with both Anuvir and Neha. I don't think opinions would have shifted or changed if it was a woman or a man that interviewed during the focus groups and the interviews as well. And to add on or echo off of Anuvir's discussion, like I also do not know of any women that are farm workers from my family or third cousins, fourth cousins beyond. So yeah.
I just wanted to give a huge shout out to both Neha and Harsimran. I know I wrote them pretty late into the project, and then we had to play a lot of gymnastics with the IRB and get our way in. But I was glad that I was able to get them on board. It really helped with the coding process, so it was not biased. So when I was actually transcribing the interviews, assessing them, and like finding the codes that I wanted to use for the thematic analysis, it was really helpful when two other people agreed with what the themes were coming up, rather than me just like sharing what I think was coming up, which would have had like an inherent, bias in the study. So yeah, definitely it was really helpful to have two other people reviewing the transcripts and going over the codes, and then we all have a discussion and agree like, oh yeah, these were the things that actually came up, and this is like an important quote, and yeah.
Well, I think that's a fabulous place to end. It's really, I feel so thankful to have been able to see this project from the beginning discussion point to the results being presented. It just really is an amazing amount of work that has really tangible and actionable findings. And so we will stay in touch because the Ag Center at UC Davis wants to reach the Punjabi speaking community and ensure their safety in workplaces. So both on COVID and other topics, we will continue to work together in that front. Thank you everyone for joining us. We will see you again in a month on, I think it's November 4th or 2nd, the first Monday of the month at 4 p.m. Please register and join us for our next seminar. Thank you so much.